We have, first things first, 2,368 cases of coronavirus in Victoria. That is 66 more since our last update. The breakdown of those 66, and Annalise can speak in more detail to the epidemiology that sits behind those and outbreaks and any other detail that you might want. 17 of those are connected to contained outbreaks. One of those is connected to hotel quarantine. 20 are the result of routine testing, and 28 of those 66 cases are under investigation. There are 442 active cases across the state. 23 Victorians are in hospital, and 6 of those 23 are receiving intensive care. On testing, another massive day of testing, and I'm so grateful to everyone who has participated in the testing program. As I've said many times, but I'll keep saying it because it really is central to our strategy. Coming forward and getting tested if you're unwell, coming forward and getting tested even if you've got the mildest of symptoms, and of course answering yes if somebody comes to your door and offers you a test either on your doorstep or at the end of your street, is a massive contribution that you can make towards us better understanding where the virus is and then putting in place strategies to contain it. Yesterday, 24,430 tests were undertaken. We won't obviously have all of the results of those, but the previous day was another 24,000 plus day. It's a very busy program, and one that's seeing, we've just tipped over 880,000 tests, in fact 881,021 tests since January the 1st. Obviously there are lots of things that we're asking of the Victorian community, and particularly those in hotspot suburbs, but that key point about coming forward and getting tested if you're unwell remains so important. Obviously, those that are in those hotspot postcodes, as well as every single person across the state, need to keep following the rules. I know it is frustrating, I know it is very challenging, and people would prefer not to be in the circumstances we are in. I understand that. We all desperately want this to be over, but we've got to get on top of this spike. We've got to get on top of these unacceptably high case numbers, and whilst it may be too early for us to be talking about trends, a day with 66 is obviously far preferable to seeing a doubling and then a doubling again. So we are starting to see, with all the usual caveats, we can't predict what tomorrow's numbers will be. We do need more time in order to get, I think, a firmer hold on whether there's a positive trend there. But certainly to see these numbers relatively consistent is very pleasing. We'll be able to talk in more definitive terms as the days pass and as we get further into what is, I think, the biggest testing program, certainly the most targeted, the most localised, the most focused testing program that anybody has done anywhere in the country, and one that serves us so well. So please, if you're asked to take a test, please say yes. If you have symptoms, any illness, even mild illness, please come forward and get tested. But of course, the other message to those Victorians who may have even the mildest of symptoms, the only reason that you'd be going out would be to get tested. We just can't run the risk that people continue to go about their business, because that can, as we've seen, that can, as we all know now, that can lead to the virus being transmitted. I just wanted to make reference to in the scheme of things, a small amount of money, but when you think about the context, it'll make a powerful difference. I can announce today just under $2 million in additional funding. That's on top of the just under $60 million we've already provided for targeted and localised mental health support for those who really are doing it very tough. That extra funding will go to mental health service providers and mental health support, with a real focus on those hotspot suburbs, so the people who are under significant stress and are dealing with really significant challenges, very real challenges, can get the support, the care that they need now more than ever. I made some comments last weekend when we foreshadowed, and then of course when we announced these lockdowns, that we would provide any and all support to families, to businesses. We've made some announcements in that space. This adds to that, and of course we will do more and have more to say about support for those families, for those communities in coming days and weeks. The The final point I just want to make before I ask Jenny to talk a little bit more about testing, and then we'll go to questions. I know and understand that those families in those 10 postcodes, you are on the front line of this for all of us. You are making enormous sacrifices. It's about your safety, of course, but it's also about the safety of the entire state. And I can't say how grateful and how proud I am to think that people in those 10 postcodes are following the rules, are doing the right thing. From my government to you, from my family to yours, I say thank you. Thank you so very much. We will continue to support you in any way we can, but be in no doubt you have the gratitude of the government and of all Victorians, because what you're going through at the moment, being on the front line in our fight against this virus, is all about keeping the entire state safe and avoiding much worse outcomes. So I thank you very, very clearly. I thank you so much. I now might ask Jenny to speak about some testing sites that were the balance of those 12 testing sites we spoke to you about earlier in the week, and then we're happy to take any and all questions you have.
Thank you, Premier, and good morning. I too want to reiterate the Premier's comments that we're extremely grateful to the residents and the families living in those restricted postcode locations. We are grateful for them complying with the legal directions, and we ask them to adhere to them very, very strictly for their own safety and the safety of the entire state. And I just want to make it very clear to those residents that it is a permissible reason to leave your home to seek health or medical care. And that includes seeking mental health support as part of this boost in funding that we're announcing today. People can seek support, whether it's at the community health centre or any other mental health service in those locations, as well as accessing their elective surgery if they're booked in for one, going to the hospital emergency department if they're required to do so, or visiting their GP. And most importantly, it's important that those communities understand that they can leave their home legally in order to be tested for coronavirus. We are making it much easier for those individuals, those families in those restricted postcodes to be tested than ever before. We're very grateful for the fact that we have already smashed our targets in terms of where we were hoping to get with testing, and we want to encourage people to go and get tested. So just in the last period, in the last week since we started this suburban testing blitz last Thursday, we've now had more than 164,000 people who have been tested across Victoria, and more than nearly 95,000 doors have been knocked. And we are now at an enormously high testing rate per 100,000, 13,359 tests per 100,000 Victorians, bringing us to that total of 881,000 that the Premier mentioned just before. So as part of that, we have found 449 confirmed cases. The postcodes with the highest number of new cases in the past week have been 3064, 3047, 3031 and 3060. And this also includes 111 confirmed cases of community transmission. Disappointingly, however, we have had more than 10,000 people who have refused to be tested. Now, that might be for a range of reasons, including that they may have already been tested in a different location. We are analysing that data to see exactly why people are refusing, but it is concerning that the report that I have received is that some people believe that coronavirus is a conspiracy or that it won't impact on them. So what I want to stress here is that coronavirus is a very contagious virus. It can go through your family very quickly. It can affect your neighbours, it can affect your loved ones, it can affect your entire community. So for those individuals in those communities who have not yet been tested, we are urging them to get tested as quickly as possible. As I said, we are making it much easier for people to be tested than ever before. We've already put in place about 10 additional testing locations to add to the 22 existing testing sites in those restricted postcode areas. And from today, we have new sites opening. And they are RMIT Brunswick Campus, Flemington Community Centre, Oak Park Sports and Aquatic Centres, and we will be keeping the community informed of any additional locations. But we will also be providing more mobile testing sites, and from today, they will be in the following suburbs: in Maidstone, in Fawkner, Brunswick West and Auburn Vale, and from tomorrow moving to Glenroy and Craigieburn, Roxburgh Park. So to those individuals, I would say, of course, if you are in those restricted postcode areas, the test is free. You can be tested regardless of whether you have symptoms, and we're making it much easier for your children to be tested through the saliva test as well as members of your own family. Just finally, really quickly, I'm just going to give you some data around the number of tests processed by postcode, and we can provide further data for you on that postcode basis. But for 3012, that's Brooklyn, Kingsvale, Maidstone, Tottenham and West Footscray, we've had 2,502 tests processed in the last week. In 3021, we've had 1,998 tests processed. In 3032, we've had 1,476 tests processed. For 3038, that is 2,815 tests processed. For 3042, we've had 600 tests processed. For 3046, 2,014 tests processed. For 3047, 3,564 tests processed. And for 3055, 1,304 tests processed. In 3060, 1,713 tests processed, and for 3064, 4,655 tests processed. Obviously, the population size of different postcodes does vary across those locations, so I don't want the numbers to necessarily reflect more willingness than others across those communities. The population does vary enormously across those locations. Finally, I just wanted to add a couple more supports that are available to those communities. Obviously, we're providing this additional mental health support that the Premier's just announced, but I also want to remind those families that there are emergency relief packages available to them if they require it. So if they test positive, or they are isolating because they are a close contact, or in fact if they are waiting for a test result to come back, and they need some basic essentials, we can get an emergency relief package dropped off to them, and that is essentially 2 weeks worth of supplies of basic food staples together with some basic toiletry products, and for those families that require it, baby food and nappies and essentials for babies as well. So that all they need to do is call the coronavirus hotline and that can access that support. Finally, we have spoken about this before, but just to remind those families as well, if they need to be isolating because they're either diagnosed or they're a close contact and they have no financial means of support, they can't access their sick leave, for example, from an employer, they've got no other means of financial support, they can also access a $1,500 hardship payment to make sure that people are not making the wrong choice, and that is to go for a financial payment or to go to work rather than complying with the Chief Health Officer's legal directions. So I'll leave it there, and of course we'll be very happy to take your questions.
Just before we do questions, can I just add that I remain very, very grateful to interstate colleagues who have provided both laboratory capacity, and that's why we can do more tests than we've ever done in a single day, and there's perhaps even capacity to go further, and that's why there's so many more mobile sites, so many more drive-throughs that have been stood up, and indeed many, many tens of thousands of doors that will continue to be door-knocked where tests will be offered. So I'm very grateful to other First Minister colleagues who have stepped up to provide us with the same sort of assistance that we all provide each other, and Victoria can be proud of our record when it comes to fire and flood and other issues like that. I can also confirm with you that I've had a conversation with the Prime Minister this morning and again expressed Victoria's gratitude for the support that we're receiving, and we're very confident we will continue to receive. The way that relationship works is if I ask for something, then the Prime Minister's answer is yes, and that is a great comfort, I know, to me and my team, to the public health team, and a great comfort, I'm sure, to the broader Victorian community to think that governments are all focused on doing everything that needs to be done to make this strategy work. to contain this virus where it is at its worst, and then recommence a program of careful and well-considered easing. That is still some time off, but again, I don't want to too heavily caveat, but the relative stability, early signs of stability in these numbers is certainly much better than having this rate double and double again, day on day. We'll only really have a clear picture once two things happen. Firstly, more days pass, and secondly, as each of those days pass, Victorians come forward and get tested. That's the most important thing. Happy to take any questions.
Are you able to repeat those top 4 postcodes where the virus is at the moment?
Sure.
And are you able to give numbers of how many positive cases there are in those postcodes? Thank you.
Sure.
Okay, sorry, there was a lot of numbers in that report. So the postcodes with the highest number of new cases over the past week have been 3064, 3047, 3031 and 3060. Just in terms of Rachel's question about cases, what I can tell you, because obviously we have both active cases as well as close contacts, and it's important that the residents in those communities understand they have many families who are actually isolating as we speak in those communities because they are close contacts. So the active cases doesn't necessarily reflect that, but in terms of active cases, in 3012 there are 8 active cases. So these are numbers as of the end of last night. As in postcode 3021, 16 active cases. In postcode 3032, 9 active cases. In postcode 3038, 4 active cases. In postcode 3042, 2 active cases. In postcode 3046, 10 active cases. In postcode 3047, 25 active cases. In postcode 3055, 3 active cases. In postcode 3060, 11 active cases. And in postcode 3064, 52 active cases. Now, in some of these postcodes, we might have in excess of 100 families or 100 individuals, 100 individuals who are currently isolating as a close contact. So the risk factor is there not just because we've got active cases, but also we've got close contacts who might potentially then be test positive themselves because they've been exposed to someone with the virus. So the active case is not just the only number we look at. We look at a range of matrix and a number of indicators of risk in those communities, which the Premier spoke at some length about the other day.
Might be worth me just going back over that for a moment, because I know there'll be, obviously, communities across the state will be very much interested in how things are tracking in non-hotspot postcodes, whether they be close by or much further afield. But just for the purposes of clarity, there is a 3-step process. The first step is to identify, this is all off data, to identify priority local government areas with more than twice the state case rate. Then secondly, to review all postcodes within that local government area. And then thirdly, to identify priority suburbs with more than 5 cases and a rate greater than 20 per 100,000. So they are the 3 criteria. So what the other way to make that clear to people is, as we approach a week now since the suburban testing blitz began in the intervening period, obviously we've moved to the stay-at-home orders in those 10 postcodes, but the weekend will be spent, many hours over the weekend will be spent analysing, considering, discussing back and forth what the status of other postcodes are, and then we'll have further announcements to make if indeed we need to, based on what that data tells us. The clarity of that formula is very, very important. Now, I can't for a moment guarantee that formula wouldn't at some point in the future change. I've tried to be as upfront as I can in saying I certainly cannot rule out other suburbs being shut down, but the key point here is that if people follow the rules, if we keep getting these sort of test numbers, and if I haven't got the latest number today, but we're well and truly over 1,000 people who are out there doing contact tracing. It's probably closer to 1,600 people. Then you've got all of that force of people that are out there door knocking. So many thousands of people. We'll keep they'll keep doing that important work, and that'll mean we can contain cases as they present. But I can't rule out further restrictions, and we certainly can't rule out other postcodes on that formula being pulled into this. Ultimately, if you've got unsustainably high case numbers in a given geographical area, then that's not a matter of running a commentary on that postcode or the people who live and work there. It's nothing like that at all. It's simply a statement of fact that you've got a problem and you need to take, really significant action to pull this up. I'm not announcing that today. I'm not even foreshadowing it. I'm simply saying you can't rule that out because we're being driven by the data, and the data obviously changes from day to day.
Premier,
Based on yesterday-
3031 you've just read out is not in lockdown, and that's in the top 4. That's Flemington and Kensington and parts of Melbourne.
And yeah,
Will that be
and
locked down? Because that clearly is.
no, hang on, no, Rich. The reason that I just went to the fact that there's a 3-step process is so that everyone can have complete clarity about how decisions to add, how decisions across the board will be made. They'll be made on data. They're not made by me. They're made. The ultimate action will be taken by me if it needs to be, but it's on the best health advice, and that's the criteria that the public health officials have put forward, and that's why every day there is rigorous analysis of the data, and then no one day would be enough to make a decision like that. You would need to look at the trend, you need to look at where the virus is heading in a given area, and then make what is a very serious decision and a very challenging one, but if it has to be made, it will be.
Can we just ask the Deputy Chief Health Officer for your interpretation of today's data and
Sure.
where I guess things are trending in those hotspot suburbs and those other suburbs? Are you comfortable?
Sure. So I would very much echo the Premier's words in terms of, obviously we don't like seeing 66 cases, but it is somewhat comforting that we have had a degree of stability over the last few days in terms of the overall numbers, and in particular in terms of the fact that there is huge numbers of testing occurring in all of these places, and that is not to date, and again I wouldn't want to foreshadow what might come tomorrow or Sunday or next week, but to date the numbers haven't been doubling and doubling again. So in terms of the priority hotspots, our overall, as a general view, that northwest corridor is really where the majority of our cases are still focused. I don't have exact postcodes for every case from the last 24 hours, but certainly that northwest corridor, where the hotspots and where the postcodes that have been had additional restrictions placed, is still where the majority of cases are really concentrated at this point in time.
And how's the community transmission rate tracking?
We are seeing increased numbers of community transmission because we know these cases are out there in the community. So I suppose there is an important distinction to make in terms of community transmission. We designate a case who, after a day or two of investigation and looking, doesn't have a very clear link. That person may, in the coming weeks, when further links are made and if other cases come up, be taken out of that, because it may become that 2 outbreaks merge, or this person gets linked to that person or gets linked to that site when further information becomes available. So, but at the moment, look, we're really concentrating very hard on cases that come up that don't have an immediate clear source of infection. So, so those are the people who we really are focusing on, and who we're really wanting to find, because we know.
Is it fair to say that in many respects this is more serious than the first wave, given the numbers are sort of up there, but there's far fewer people arriving from overseas?
I think each wave was as serious as the other. I wouldn't. The virus, in terms of its impact on the population, hasn't changed. In terms of its infectivity, hasn't changed. Obviously, we have varying circumstances during each of these waves. It's very helpful that our testing capacity has greatly expanded this time around, and our capacity to really test and find every case has really helped. So I wouldn't say I'm more or less worried. I'm equally worried now as I was last time, because the capacity of this virus to cause significant illness and to cause death and to spread quickly is exactly the same as what it was before.
Those cases in 3031, are they linked? Are they from the North Melbourne cluster at all?
I couldn't comment on individual cases from an individual postcode today, sorry.
But is that trend of, you've got 3031 in the top 4, and it's not a lockdown, would you be advising that it should probably be closed off?
We'd have to get back to you on the individual cases from today, and as the Premier said, any single day's worth of data or cases in isolation isn't necessarily going to be enough to cause lockdown or not lockdown. We're going to be looking at trends week by week, and trends based not just on absolute numbers but also rates, as the Premier mentioned.
Based on yesterday's data, we had 208 cases in local government areas that include those 10 postcodes and 207 cases outside those local government areas that include the lockdown postcodes. Is there a danger, we've got, with 207 active cases outside those postcodes at least, that people are going to be dropping the ball on paying attention to this, and that we'll get a lot of spread outside those postcodes?
Look, I certainly hope not. The message to everybody is stay home if you're sick, be vigilant and get tested if you have any symptoms at all, and that applies across the state regardless of whether you're in a hotspot suburb, whether you're in Metro Melbourne or whether you're in a regional area. So I certainly hope not, and we absolutely are not changing our intensive case interviewing and contact tracing of every case regardless of whether they're in a hotspot suburb or not. So that doesn't change at all.
The rail, tram and bus unions pushing for masks to be made mandatory on public transport. That's not something you required up until now. Any thoughts on changing that, or are you comfortable with the things as they stand?
So the recommendations are constantly under review, and I believe there is some further reviewing being undertaken at the moment. The current position is that it is, if people wish to wear a mask in public, they absolutely may, and that the WHO recommendations are that if people feel they are unable to appropriately physically distance in a space, and that may include people who are travelling on public transport, particularly in areas where there is higher levels of community transmission, that masks may be of benefit in those circumstances.
Why did the man who left Victorian hotel quarantine to head to New South Wales and tested positive in New South Wales for coronavirus for a second time, why was he not tested again, having previously tested positive for coronavirus before he was allowed to leave hotel quarantine?
Sure. So there's a standard set of release from isolation criteria that is agreed upon nationally, and that is consistent as well with the WHO criteria, and that is when a patient has had more than 10 days or more since their onset of symptoms, including 72 hours being symptom-free and fever-free, they are released from isolation. They are clinically cleared to be released from isolation. The reason that doesn't include a clearance test is because people can shed this virus for weeks to months, and shedding a virus is not the same as being infectious with a virus. This man met that criteria and then stayed for another 2 days on top of having met the release from isolation criteria because he was still in hotel quarantine. He would have been released from any hotel quarantine in the country based on that criteria, including any hotel in Sydney for a person coming back to Melbourne.
You've said he met the criteria. Is that the same as saying, are you confident that he was safe to leave hotel quarantine, that he didn't pose a risk to the community?
Yes, I am confident.
Premier, can we just ask, given the breakdown in the hotel quarantine system, do you have confidence in the Health Minister and the Secretary of the Department?
Yes, and what I'm focused on at the moment is making sure that each of us, and it is a very large number of people, thousands and thousands of people, are all working as hard as we possibly can to pull this virus up in those hotspots and to continue to provide support and care to those who are doing it tough. And there are many families, and again I'll take the opportunity to acknowledge that they are on the front line of this, for them and for all of us. And no one is in any doubt that it's tough. And we send our best wishes, our thanks and our support in very real and practical terms, and I'll have more to say about other ways in which we can support particularly vulnerable people in those 10 postcodes. That's what has to dominate our work and our thinking. That's what is dominating everything we're doing day and night, and we will not be diverted from that. The most important thing is to pull this up, get on top of it, contain it, and then drive those numbers down so that we can get back to a program, a cautious program of easing, so that we can not only have the appropriate public health response, but also look to repair many of the really significant challenges we have across the Victorian economy.
Given the problems, how can you have confidence in the Minister, in the Secretary, given
I've
the
answered
enormity of the problem?
I've answered your question, Nick. We have a judicial inquiry. That is the appropriate way to go. I think that former Justice Coate is someone who brings a lifetime of skill, a very well proven record of the ability to get to the bottom of what has gone on here with absolute clarity. And there will be accountability, absolutely. And I am the leader of the government, and I absolutely acknowledge this is unacceptable, what has gone on here. And that's why I've established the inquiry, and that's why the inquiry will do its work at arm's length. It'll be independent, it'll be appropriate, it'll get to the bottom of what's happened. Corrections Victoria staff are in there as part of a reset of this hotel quarantine. I think they are the best people, they are best placed given the work that they do and the skills they have to guarantee that everything is being done appropriately. Beyond that, we are focused where we should be focused, and that is making sure that we contain, stabilise and drive down these case numbers in those hotspot postcodes, and indeed deal with every single positive case, every close contact of a positive case right across our state.
Minister, this was your department. Do you accept some responsibility for this?
So firstly, can I say that I welcome and support the judicial inquiry that the Premier announced the other day. Lisa Neville explained yesterday that there was a National Cabinet decision, and following that there were arrangements put in place that were stood up very, very quickly, involving many agencies. So this is a multi-agency response that has been in charge of the hotel quarantine program from the start. My department, the Department of Health and Human Services, has never had the contracts with the security companies. Its focus has been, one, to provide the legal framework. There were legal directions signed off by the Chief Health Officer that legally required people to be quarantining those hotels, and then to provide the mental health, including the mental health and wellbeing support for those travellers in those hotels. But I have no concerns whatsoever about the role of my department in the operations of this program being thoroughly examined by this judicial inquiry. The other point I want to make is this, is that since January, I have been working every day to ensure that we have the appropriate health response to deal with what is an unprecedented health challenge in our lifetime. To make sure that our hospitals have what they need, to make sure that our public health team has the resources that they need to do the testing and the contact tracing that's required. And I'm grateful to the Premier for a nearly $2 billion investment that has been put in place to make sure that our health system is able to withstand the challenges. And I think that they are well prepared and ready to withstand even the increasing numbers of hospitalisations that we've had in recent days. That has been my focus. That will continue to be my focus. My department, as will all agencies, will support and cooperate this judicial inquiry fully. And can I just say it also, because I have been here on previous occasions and was surprised not to be asked any questions on this, that as we have had an upsurge in active cases in the last 2 weeks, I have been very anxious. I was very anxious back in March and April when we had a significant spike in coronavirus cases in Victoria, and I looked at the international experience and I was absolutely riddled with anxiety about what would happen in our state. And I'm very grateful for the fact that overwhelmingly Victorians did the right thing. We drove case numbers down, and I believe that with the legal restrictions that have been put in place this week, we will do that again, and we will do that successfully. But as the case numbers went up in the last 2 weeks, I sought some explanations. I wanted to know what had gone wrong. Now, on Tuesday, I received a briefing of a genomic sequencing report that seemed to suggest that that there seemed to be a single source of infection for many of the cases that have gone across the northern and western suburbs of Melbourne. It appears to be even potentially a super spreader that has caused this upsurge in cases. Now, we don't have the full picture yet, and as Brett explained the other day, not all of these cases have yet been subject to genomic sequencing. We need to enable that process to be completed and to be provided to the judicial inquiry in the fullness of time. But I was concerned about this, and I know the Premier was concerned, and it takes a great deal of political courage to admit that there are problems, that there have been mistakes made, and to actually call for a judicial inquiry. Now, no other state, as I understand it, has been doing genomic sequencing of its cases. We don't know whether cases from the Ruby Princess came to Victoria and seeded cases in Victoria. We know some people from New South Wales did travel to Victoria and were directly related to the Ruby Princess. No other state has subjected itself to the level of scrutiny that Victoria has. So this genomic sequencing tells us a part of a story, but it is important that the judicial inquiry be enabled to thoroughly examine what went wrong here. I have to say that I am deeply, deeply frustrated by what has happened here. Deeply frustrated, because we were doing extremely well, and only 2 to 3 weeks ago we had some days of 0 cases. So to see an upsurge of cases in 2 weeks is deeply frustrating to me. And I know it's deeply frustrating to Victorians as well, but we have managed this before and we will manage it again. We will drive these case numbers down, and we will get some explanations about what went wrong with this hotel quarantine program. Everyone deserves to get some explanations. You will get that explanation when that inquiry is completed. I know you will have no doubt many questions about the role of my department and others during this whole program. There have been many resets and changes along the way, as we have explained on numerous occasions, with Alfred Health coming in and providing additional supports for the hotel that deals with the positive cases, and many changes being made along the way. But we should enable the judicial inquiry to complete its process so that we get to the bottom of what happened.
Which department did manage the contract?
Well, what I can say to you, it's not my department, okay? You asked me a question, and I'm saying to you, it's not DHHS, and that is why it's important that the judicial inquiry completes its work, explains what role every agency played, what role every department played, who made what decision, who knew what when. And what I can say to you is my department did not manage those contracts at no point in the process, and the role of my department will be thoroughly examined as it should be. And I have no anxiety about that whatsoever. I support this inquiry. I think it's important that we get to the heart of what went wrong here to make sure improvements can be made. Already there have been significant changes to this program, and the Premier has explained that there is a complete reset over the next 2 weeks with Corrections Victoria staff coming in to manage the program. I welcome that. I think that is going to make a world of difference to how this program will operate in the future. But, you know, this has been a challenging environment where we have faced an unprecedented threat in our community. Decisions have been made by the National Cabinet, and they have been put into action almost overnight. Now that means you can't pull out a manual and do everything in the way that you would if you had the benefit of time. And people have acted in work incredibly hard across our public servants, across all these agencies, to do the best job that they possibly could. But I'm going to leave it at that, because I think it's important that I not prejudge the inquiry, that none of us here prejudge the inquiry. We let the judicial inquiry and Jennifer Cope do her job and get to the bottom of what happened, who did what, when, and to give us some explanations and also perhaps some suggestions and recommendations about how we should manage this program going into the future.
Just to clarify, you said it wasn't.
Minister, when did you or your department, when were you made aware of concerns in the hotels around the availability of PPE, infection control protocols, and physical distancing between staff?
So all these questions will be examined thoroughly by the inquiry, because employers had contractual obligations to provide training and PPE to their staff. We went above and beyond that, providing PPE to these hotels. Clearly, some people may not have followed all the infection control protocols. That's the only explanation we can give as to what has happened with those breakdowns of infection control and people.
Weren't even told about infection control control protocols to
Yeah,
follow.
but Andrew, as I said, it's important that we not prejudge this inquiry. Let the inquiry do its job. I know that there are people making comments in the media, and it's not my intention, beyond my comments today, to provide a running commentary of this judicial inquiry. I'm going to let it do its job. Let them examine exactly what agency did what their respective roles were as part of this multi-agency response, and what advice was given. I have no
We
concerns
don't need the
whatsoever
inquiry
about that.
to tell us when you were aware of the concerns. You must know that.
I became aware that there were issues when we had the first case at the first hotel.
Premier, can we ask you?
Sure, Nick.
Did you take part in the decision not to use police, PSOs, or the defence force?
Well, let's just go. That's a fair question. Let's just go back to the first part of this. National Cabinet did not make a decision requiring ADF involvement. National Cabinet did not make a decision requiring law enforcement involvement. I know that's been reported. That's simply wrong. And as someone who's in the National Cabinet, I would put it to you that I'm well acquainted with the decision that was made. On the issue of ADF support, it is simply wrong to say that the ADF are supporting hotel quarantine across the whole country. That is not wrong. It's not a criticism of the ADF, but the notion that there's not a security guard working anywhere in the country doing this other than in Victoria is not accurate. The ADF are providing support, and I'm sure they're doing a fantastic job in relation to transport between the airport and hotels in Sydney. We had conversations with the ADF about doing the same thing, playing that same role here in Melbourne, and it was deemed, I think, by agreement between the government and the Australian Defence Force that they'd simply be replicating the work that Skybus is doing now and doing well. Again, I can't control claims and comments and opinions that are put out there. That's part of a free society, no problem at all. But the facts are the facts. The notion that the ADF is running this everywhere except Victoria is just not accurate. It's just not accurate. However, I would again make the point. I have not established a judicial inquiry chaired by a very well respected and highly qualified person to stand here and try and run her inquiry for her. I understand why questions are asked. The best way to answer those questions is to have a rigorous review, then provide a report with findings, with recommendations. I've made the point to you before, I am the leader of this government and I take responsibility and have accountability for these and all matters. I understand that. I've never walked away from that, ever, nor would I. But the best thing in my judgment is to focus on the things you can control, and none of us can go back and change any of that. We've got to be focused on what's confronting us right now, and that is an unacceptably high number of cases and the real risk that we're not just shutting down 10 postcodes, but we're shutting down all postcodes. I want to do everything I possibly can to avoid that.
Premier, why can't you say why you didn't take up the offer of ADF as the
Well,
staff
what I'm pointing to...
originally? I know you've made the point about other states having
Well,
used
no,
it.
Rich,
Why didn't you
what
take
I'm...
up answer that question? That's
I think I just have. The
the
notion...
start.
No, the notion that the ADF are involved across the board or were somehow offered up to run the entire program is simply wrong. That's the point I'm making to you. You would, I hope, appreciate that I'm not interested because, of course, one never gets to have the entire context of any answer you give reported necessarily. So, and that's not no one's fault. That's just the nature of things. What I'm trying to avoid is in any way casting any aspersions on the ADF. I would not want that to be, that this is not about the notion that they weren't offered or anything like that. I'm not getting into that sort of stuff. I'm just pointing out the facts. There was an opportunity for them to be involved in transportation. They deemed and we deemed by agreement that that was not necessarily anything more or less than what we were doing now. And frankly, that's not where the problem has been, it seems. But again, that's not a judgment for me to make either. I think the notion of here is an independent process, completely at arm's length. It will go where it goes. It will call whomever it calls. It will make findings wherever they believe they need to be made. That's not for today. That is for the future. And, you know, you don't get many choices in these things, but I would just say to you, I'd rather have these questions than be here defending the fact that I hadn't set up a judicial inquiry. I don't think that'd be fair.
Was it the Department of Jobs, Precincts and Regions?
Again, it will be for, it will be.
Yes or no? That's just a simple.
Well, Rachel, you can
matter of
ask
fact,
questions.
yeah.
You can ask questions in that way if you choose to. My answer won't change though. It is for Jennifer Coate to determine who, when, what, all the arrangements that were put in place, and to then make judgments if she deems appropriate as to whether those were the right decisions or otherwise. I'm not going to go through here today or any day until the day we get the report and take you through each and every step. What I can say though is that there is a reset. Corrections Victoria are playing a much more prominent role, in fact the prominent role in relation to these matters, of course in partnership with Alfred Health, who are in charge of that the hotel where the positive cases are placed for the duration of their quarantine.
Remy, I'm not asking you to go
Firms,
through
are their
every step.
contracts
I
still
just-
being paid?
Sorry?
3 security firms, are their contracts still being paid?
I'd need to come back to you on those individual contractual arrangements, but of course anyone who is working and is in the employ of the government is expected to not only deliver on the terms of their contract, but to adhere to all protocols and procedures that are put in place.
And just a very simple matter of fact, which department was responsible for the security contracts?
Again, it is not a matter of necessarily one single department being responsible for this, and therein might be some of the challenges we face. Those matters can be appropriately established by the judicial inquiry. That's why it's been set up. And I'm not for a moment trying to make the point that these are not serious matters. They're absolutely serious. That's why a judicial inquiry has been set up.
When you stop the security guards doing other jobs, there are reports some were driving Ubers at the same time.
The reset, that is in large part complete, but there is still some further work to do, and that's why the 2-week pause was very important, to not have further return travellers arriving until we could be completely and utterly confident and take that space, that 2-week time, just to double and triple check, as well as, of course, a point that I've made a couple of times now, other states, I'm grateful that they're taking flights that might otherwise have come to Melbourne, but at the same time they're able to do that, at least in part, because they're not having to contact trace thousands of people and they haven't got 66 cases on a day like today. As far as that reset goes, I'm confident that it is being done in the appropriate way. I think Corrections Victoria are the team to do it. I'm happy to follow up on any specific issues as you've just raised, Nick. I don't have the detail of that, but I'll just go back to the earlier point. If you're in the employ of the government, then you need to adhere to the contract under which you're employed, and of course you need to be following all the processes and procedures, all the rules as it were, just like every other Victorian should be. That's a really important part of this.
When was it that you became aware of the concerns in hotels around PPE and infection control?
Well, infection control is an issue that has been brought to my attention, and it is, I think it's fair to say that that first case, the first outbreak or the first infection control breach that led to a positive case, which is I think the case that the Minister is referring to.
Just heading into the weekend, what would
Sure.
your message be, particularly Melbournians, about what they should or shouldn't be doing this weekend?
Well, I would simply say to all Melburnians, indeed all Victorians, firstly, to those in hotspot postcodes, you are on the front line of this for your family and for every Victorian family, and we are deeply grateful to you. We understand, we know this is very challenging, and we would much prefer not to have suburbs locked down. We will support you, we will get to you the things you need, and part of that is an acknowledgement of the sacrifice, an acknowledgement that those families are on the front line for all of us in the war against coronavirus. In terms of the rest of Melbourne and Victoria, it's on us as well. You don't have to live in a hotspot postcode to follow the rules. And if people don't follow the rules, then you will be living in a hotspot postcode, because I'll have no choice but to shut down more and more parts of our city and potentially our state. We don't want it to get to that. If you're sick, the only thing you should be doing is coming forward and getting tested. You can't go to work. You can't visit friends. You can't pretend that you aren't sick. This thing is so wildly infectious. It only takes one person, and you can finish up with entire suburbs locked down. That's the fact of this. And I know that is sometimes hard to get all of us to get our head around, but it's absolutely true. One person can be the difference. Your poor behaviour, your bad decision can be the difference between an entire suburb being locked down, an entire postcode being locked down. So if we all follow the rules, if we all look out for each other, if we support each other at this time, we can bring some stability, we can drive down these case numbers, and we can then again resume opening up the Victorian economy.
You
Can I ask a question about
asked
testing?
a question about the ADF. Why not the police or the PSOs? Because I understand in the state
Sure.
they have been heavily involved in this.
Indeed, that is true, and again, part of the suitability or otherwise of arrangements that was put in place, that will be dealt with by former Justice Coate. What I can confirm for you is that Corrections Victoria, as part of the reset of this program, are playing that leadership role, and I think that's the most appropriate way to go.
Did you play a part in that decision, of the initial decision not to use police?
Well, Nick, what I'd say to you is this: whether you play a part, however you might define that, I'm accountable for the decisions of this government. I've never walked away from that, nor would I.
Premier, in relation to testing, do-it-yourself test kits being dropped off at
They are.
residences in hotspots. How does that work?
They
And
are.
Is the offer being taken up by people?
I might ask Annalise if she's got any data, or we can come back to you. With the advent of the saliva test, then obviously that self-administered test becomes even easier. But there are both the nasal and throat swab tests that are being left for people to self-administer, which can be perhaps a less unpleasant experience if you're doing it yourself. And then, of course, the saliva tests, particularly for little kids and other cohorts where it can be a barrier to getting tested, the attendant discomfort with the other test. But in terms of drop-offs and pick-ups and some of the mechanics of that, I'm sure Annalise can speak to that.
Certainly. So really the aim is to really minimise any barriers for people to get tested, and one of those barriers is people physically being able to attend a testing site. We know that there are people who go to work, might not be home when the door knockers attend, so there are kits being dropped off in hotspot areas for people to undertake self-testing. There is an extensive instruction sheet there, and then there's a reasonably simple process for people to either text message or call for that kit to be taken, picked up at their home and then tested. So this is really for asymptomatic people. There's a process for further testing if any of those come up positive. But really the main aim is that so everybody who we want to get tested has the access to a test, and that is as easy as possible for them to do.
Are you concerned about that nasal test being administered correctly by people or incorrectly by people?
So look, there is always a balance there between people administering a test correctly in terms of being self-administered versus a healthcare worker, and that is the reason why this is for asymptomatic screening, and there are extensive instructions, and those have been validated by the laboratories who are undertaking this test. So we've taken the self-collect instructions directly from their instructions, and so they were confident that these tests had been working well in the settings in which they had been employing them prior to this. But at this point in time, we would still prefer people to actually get tested. So if a small proportion of people perhaps don't do the test as well as we would like to, but none of them would otherwise have got tested at all, we would still prefer that those people get tested at all.
That postcode 3031 is in the top recent cases but not on lockdown. People who live in that postcode will probably read that and be concerned. Can you just explain what the next steps are concerning that postcode and what your message to people who live in that postcode would be?
So my message for people who live in any postcode is to be concerned, because this is a pandemic and it's not gone away. And if you are sick, to please get tested, and please stay home. And that is the same for postcodes who've had any cases or no cases. In terms of the next step, as the Premier outlined, we have a comprehensive analysis system which takes into account both individual test numbers, testing both positivity rates across LGAs in order to filter down to then identify postcodes of concern, and then we are looking at both overall numbers in those postcodes of concern and rates in those postcodes of concern, and those data are being reviewed both daily and on a weekly basis as well.
How many people is this super spreader that the Minister suggests is out there that's responsible for cases?
So in terms of that is we don't have definitive evidence that there has been a single super spreader. What we have evidence is that the current outbreak is possibly is looking more like what we call a point source outbreak. So there were tapering off of cases, and then now the cases have gone up. So there's a number of things that can cause an outbreak that looks like this, and that can be multiple introductions or a single introduction that causes multiple outbreaks. One of the possibilities that can do that is a person who is particularly infectious who attends multiple areas or multiple places, or it could be, as has happened in March, multiple introductions from overseas. So we don't have a single super spreader per se, but it is one of the epidemiological theories that is being looked at by our team of very experienced epidemiologists who are trying to work through the data that we're getting about cases.
Do you know, does the department know, and I'm not going to ask for their name, who this person is?
What I said,
who one of these potential people might be?
to clarify again, this is a possible epidemiological theory about one of the things that may have caused this outbreak. There is not an identified super spreader at this point in time. It is one of the options, it's one of the possibilities, looking at the data compared to other outbreaks that has happened that may have contributed to the current spike in cases. But there is not a single identified person who is a super spreader at this point in time.
Last question, please.
Have you got any more detail on today's outbreaks?
So we have some cases, further cases that have been linked to a family outbreak in the Roxburgh Park area, so that's 3 further cases.
So 23 total?
23 total, yes. We have further cases that have been linked to Altaqua College, and that college has now been entirely placed in quarantine, all staff and students. We're working very closely with the college and the Department of Education on that front.
How many cases total?
That is now up to 23. We have 3 further cases in close contacts of Stamford Plaza, so that is people who we knew to be at risk and who are receiving testing at the end of their quarantine. That is not new cases that were unexpected. We have...
Sorry, does that rise to 35 then?
It does, yes. And we have single new cases at Alban Vale Primary School, Origin Youth Mental Health and Villa Bambini, and all of those were people who were known to be close contacts.
Beyond that, can I just say that the process, the first of those weekly reviews of all the data that we have will be conducted tonight, Saturday, Sunday, and people can be absolutely confident that the best public health advice, the best public health experts will be doing that data crunching in order to make sure that we've got the most appropriate settings in place. Again, just to finish, to all of those on the front line of our fight against this virus in those lockdown suburbs, you're doing it not just for your family but for every single Victorian family, and I can't say how proud and grateful to those families I am. We're very proud of those families. We're very grateful to them. They are on the front line of our fight against this virus for their family and every Victorian family, and we will support them right throughout this 4-week period. Beyond that, every other Victorian can play a part in making sure that their suburb doesn't get locked down, and that's by following the rules, using common sense and good judgment for them, for their family, and for every single Victorian family. If there's no other issues, very good. Thanks very much, everyone.